Tonight we're going to review some of the accomplishments and some of our goals for next year. So to start, so we're going to talk a little bit about the planning for the block grant. The Human Services Block Grant, as some of you may remember, was initiated in fiscal year 2012-2013 when it was under Act 80. What that did was it took funding that was historically in categorical offices like mental health and intellectual and developmental disabilities, drug and alcohol, and adult and family services, and put it together in one funding stream, or one block grant, so the counties could have the discretion to use those dollars as they felt fit for their own county. Delaware County was among one of the first 20 pilot counties in the state, and this allowed us to initiate several different programs, as well as to fill some of the gaps. So in order to put the plan together, every year we have a group of folks on our actual planning team within the county that pull all the ideas together, pull the financial pieces together, talk about the programmatic achievements, talk about some of the things we want to do in the next fiscal year. So this is just a list of the planning team within the county, within the Department of Human Services. We also invite stakeholders to participate in the process. Stakeholders could be anywhere from public groups, advisory boards, like the Mental Health and Intellectual Disabilities Advisory Board, the Drug and Alcohol Advisory Board, and we work with other county departments such as the District Attorney's Office, the Public Defender, the prison, and so forth, as well as providers within the community. So this is just a list of some of the stakeholders who did have input into this planning for the upcoming fiscal year. So to talk a little bit about the block grant, one of the things that's been very beneficial to Delaware County is the flexibility of the programming. As I said, we could use those dollars within any of those categoricals as we see fit. Initially, there were some requirements on it that we could only use. We had to leave 75% of the funding within this specific categorical, and then it was reduced to 50% and so forth. Currently, we can use any amount we wish, move it between the categorical offices. We just cannot eliminate any of the funding groupings. The other piece of the block grant that's been very beneficial is we can keep up to 5% of the state funds that we don't use and use them in the following year. So with this flexibility, we're able to fill gaps that might be in services. When the block grant was first initiated, we had a lot of issues with funding drug and alcohol programming. What would happen is at some point during the year, we'd have to close the system because there were no more dollars to have the individuals go into treatment. With the ability to move funds within the block grant, we were able to take monies, and initially it was with mental health, that originally would be returned to the state because we didn't use them, and then move those dollars to support individuals with substance use. Then after several years, we were able to move money for intellectual and developmental disabilities. We've also supported things like shelter programming and funded initiatives funded capital improvements for some of the programs within our services to provide some of the services to our residents. So the flexibility has been very beneficial, as has the ability to take money and carry it forward each year. So with that, I will turn it over to Angelique Hires, who is the Human Services Director, to talk about the overall accomplishments.
Good evening. The Human Services mission statement is Delaware County Human Services is committed to addressing the social service needs of county residents in an inclusive and equitable manner with a holistic, trauma-informed, culturally competent, fiscally responsible approach designed to meet the statutory mandates of the respective program offices. And for fiscal year 24-25, I'm going to go over some of the accomplishments that we've had and also some of our goals for 25 and 26. So we're proud. It's been a strong year in terms of us building with staffing, moving to a new building, structuring it so that we can support many of the programs that we've had moving forward, knowing that it's going to be a harder year moving into 25-26. We have had some successes in 24-25, such as collaborating with our executive leadership and quality teams to develop the first annual Department of Human Services Integrated Quality Improvement Work Plan, which is our first one, and we're going to have a second one, which we're proud to say is coming out in September. We've enhanced our partnership with the county criminal and juvenile justice system in an effort to prioritize treatment and reduce incarceration and detention. We also partner with community organizations to ensure county residents have equitable access to key programs and address the barriers to those services. We continued our Healthy Kids, Healthy Schools initiatives in conjunction with the District Attorney's Office, because all throughout Human Services, what The important thing we do want everyone to know is all about the collaboration of all the departments within the county. We've distributed and posted service maps for all human service programs, as well as promoting our no wrong door activities, increasing access to social determinants of health throughout the county. So our goals for the new year will be to finalize and transition from civil service. We also want to further extend our outreach and our collaboration with our community partners, such as the YMCA and our local food pantries, to maximize the impact. We're going to develop a community-focused DHS impact report that highlights the past accomplishments and future objectives. We also hope to enhance program monitoring and perform matrix for external contracted agencies, ensuring accountability and effectiveness. And we're looking to explore new partnerships with stakeholders to drive innovation in affordable housing and behavioral health solutions. At this time, I'm going to pass it over to Jessica Fink, our Administrator for Adult and Family Services.
Good evening. I'm the administrator for the Adult and Family Services Department. Adult and Family Services is a very diverse unit. We are the lead agency for the PA 502 Continuum of Care programs for the unhoused. We contract with community partners for homeless prevention, emergency shelter, and permanent housing. We also contract with programs for the oversight of food assistance, medical assistance transportation, and a variety of other supportive services. Our goal is to educate and provide tools to ensure equity in their services to assist families and adults in leading safe, healthy, and productive lives and break the cycle of homelessness. Our accomplishments this year include: we were able to hire an HMIS data technician to our staff, and that helped enable us to ensure compliance with the HUD requirements, as well as provide training to new and existing staff to improve data quality and ultimately increase funding. We had the privilege of providing case management to folks in a shelter for a period of time, which gave us some great insight as to how that is done. We were able to secure through PHFA funds to cover things that traditionally aren't covered in grants, and that things such as play units, diapers, wipes, and I didn't change the slide, rent, furniture, and transportation assistance, incentives to landlords outside the traditional rental spots, and funding for essential documents. Additionally, we were able to support the renovation of the Delaware County Share Food Program warehouse. That was completed in June of '25. Some of the things that we're looking forward to this upcoming year: we want to support a base of knowledge by establishing standardized training requirements for all continuum of care and contracted providers. For consistency purposes, we are establishing standardized shelter expectations for enrollment, case management practice, and length of stay. We were able to secure funding to support persons with lived experience and expertise, to include them in our discussions and decisions to make sure that we are getting a full picture of what we should be doing. We are creating an overview training to provide to members of the Homeless Services Coalition to help acclimate all new staff to the homeless services in Delaware County, and that would be presented monthly so that any new persons could have access to that training. And our goals also continue to reduce the number of households who become homeless and reduce the length of time they remain homeless. The transitioning households from emergency shelter or rapid rehousing into permanent housing whenever possible, and to increase and secure ongoing forensic funding so we can continue to provide bridge funding for housing, food, transportation, IDs, clothing, and other social determinants of health, which can help to increase community tenure and well-being of those returning to the community from prison or a regional forensic center. I'm going to turn it over to Dana Ratchko.
Good evening. I'm Dana Ratchko. I'm the Drug and Alcohol Assistant Administrator for the Office of Drug and Alcohol. In our office, we provide funding for prevention, intervention, and treatment services that are available to all eligible Delaware County adults, children, and families. Our work and efforts are also driven and guided by reducing stigma and ensuring our residents know that recovery is possible and help is available. Some of our team's accomplishments this year include expanding and enhancing our coordination with our Certified Recovery Specialist Warm Handoff Program, which was done through continued outreach and education to ER and hospital staff in order to re-educate about the program and our additional provider that we added last fiscal year. So that program is coordinated by MVP Recovery and Mainline Health. Our team also established and implemented a drug and alcohol crisis stabilization program called STAR, Stabilization, Triage, and Referral. That also included outreach to law enforcement and police departments in order to educate them about the program so they knew where to take individuals that were seeking help for substance abuse or mental health systems, and that was especially important due to the closure of Crozier. Our team expanded monitoring efforts and oversight of our contracted providers, which also included hiring a new data program analyst to enhance quality metric collection and increase program fidelity. Continuing with our Office of Drug and Alcohol accomplishments, our team developed a harm reduction policy that aligns with our state manual, our clinical services and case management manual, and our coordination efforts with the Delaware County Health Department. For example, some of these harm reduction efforts include Narcan vending machines and community outreach. Our team funded and assisted coordinating 3 social wellness events for those in recovery, which included yoga, softball, a family movie night, Hope for the Holidays event, and Recovery Olympics. Our team also hosted the first annual Delaware County Recovery Month event, Delco Hope Recovering Together. We had the pleasure of having our council chair, Dr. Taylor, attend, joining our team and connecting with over 250 attendees and 30 vendors in which we celebrated recovery. Our last set of accomplishments includes our continued effort with our prevention needs and resource assessment. And this is prioritizing the most impactful risk and protective factors in our community that we were able to include via surveys, small group conversations with youth, and adult conversations as well, focus groups. Our team provided technical assistance and support to contracted recovery house providers, which included hosting a training through PROACT's Recovery Hub that focused on enhancing communication, problem-solving skills, and appropriate conflict resolution. And we would like to increase the professionalism and quality of these services for our residents. And lastly, our team funded transportation services for all outpatient contracted providers in the county through third-party rideshare apps in order to get individuals to and from formal treatment. Lastly, our goals in the Office of Drug and Alcohol for this fiscal year include releasing a request for proposal for our recovery house services to align with the county RFP process and remain equitable to our network of providers and any newly licensed recovery houses in Delaware County. We are going to host our second annual Delco Hope event in 2025 in September. We would like to onboard 2 new case management specialists in order to increase our oversight of our outpatient authorization process. We would like to continue and maintain STAR as a program for the county, which is a critical component in our continuum of care throughout our agency. We will utilize the prevention needs and resource assessment to focus on our strategic prevention plan, but also to encourage schools to facilitate our evidence-based programming with our providers and encourage them to participate in the Pennsylvania Area Youth Survey 2025 so we can continue to collect valuable data about our students. We are going to expand our warm handoff opportunities by collaborating with the new Delaware County Overdose Response Team, which is a warm handoff EMS ride-along program. And lastly, we're going to work with our Pennsylvania Department of Drug and Alcohol Programs, our funder, with our new grant agreement to include new policies, requirements, and reporting, which will also impact our providers as a whole. With that, I'm going to pass it to Alicia Redden-Ravel.
Good evening. I'm Alicia Redden-Ravel. I am the Deputy Administrator for the Office of Intellectual and Developmental Disabilities. The mission and purpose of our office is to support individuals with developmental disabilities, to advance the health, welfare, rights, independence, and community inclusion of children and adults with intellectual and developmental disabilities or autism spectrum. We envision a community that will support the lives of the individuals that we serve, to support self-determination to the greatest extent that they can have a meaningful life in the community. Some of the accomplishments that we've continued to work collaboratively with the cross-systems team and supporting individuals that are in multiple systems, successfully providing services that meets the ongoing needs of them, identifying individuals that are transitioning from the education system, RTF programs, EPSDT, age-outs, and transitioning from those systems and making sure that they have the supports that they need when they're transitioning into the adult services. Support the medically complex children that are within hospital settings, making sure that they have services that they need, that they can go from that restrictive environment to a more community-type setting. We have increased the number of individuals working competitively, working in the community with the local businesses. Providing an opportunity for individuals to connect with community partners in order to engage in meaningful day activities, and supporting the competitive employment process by making sure that they have supports as job coaches to make sure that they're actually able to work competitively in the community. Completing the independent monitoring for quality, review for individuals with disabilities, the no immediate health and safety needs or any concerns. Host a community provider fair, which provides the opportunity for families and individuals to meet and connect with other provider agencies and to provide other additional services. We successfully enrolled 10 participants in the housing pilot voucher program during our last fiscal year, and I would like to say that we are only one of 12 counties within the state of Pennsylvania that is in this pilot. And we've been successful in supporting individuals that with an autism diagnosis, some of our individuals are visually and hearing impaired, and making sure that they have all the supports that they need to be able to live in an apartment setting for the very first time and graduating from living at home with mom or a caregiver. So that is something we are very, very proud of. So some of our goals and ongoing initiatives is making sure that we share and provide opportunities for people to continually to live independently in the community, providing opportunities for people to live in less restricted environments like our life sharing and supported living type of living arrangements, making sure that we continue to work collaboratively with our cross systems to make sure that we're engaging in activities that will build the independence and help the transition process. To continue to provide education to our families and providers, implementing the multi-year growth strategies and planning in order to increase capacity. And this really addresses our people that are on the PUNS list waiting for waiver supports. And so this is a state initiative across the state of Pennsylvania, and just looking at people that may be in one of the more restrictive settings and seeing if they are eligible to go in a less restrictive setting, which will then free up some funding from our consolidated waiver, people moving in some of the lower waiver fundings into our community living waiver. And so that's an initiative that we're really, really committed to, making sure we're addressing the emergency waiting list. We have a lot of people that are waiting for services. So that is a cross-collaborative effort that we want to make sure that all parties are involved, that everyone has the information, and that we're supporting the needs of the individuals and families. Continue to support individuals in their everyday life by utilizing the tools for the life course and addressing behavioral supports needed by enhancing the dual diagnosis treatment team. That's, again, a cross-collaborative effort. We work in conjunction with Montgomery County, Chester County, coming together, looking at the services and making sure all of the treatment is put in place to be able to really support that individual in having a meaningful life. To increase enrollment of participants in the housing voucher program, again, we have the support of the Office of Developmental Programs to be able to expand that initiative. So we definitely want to be able to increase our enrollment by another additional 20 participants this year. Strengthen our partnerships, communication, provider networks to address systemic barriers. Many times when we're meeting with families, there's a lot of issues that we are not necessarily abreast of. Some of the barriers when you're doing the transition age process. We want to make sure that we have systems that are in place to be able to support everyone that's transitioning, whether it's from the EPSDT aging out from RTF, aging out from the education system, to make sure that we have systems in place to address those needs. And lastly, to review and enhance the intake unit and quality management unit to ensure timely program enrollment for services and all incidents of health and safety are investigated timely. Now I'll pass it along to Janet Dritline.
Good evening, I'm Janet Dreitline. I'm the Mental Health and Intellectual and Developmental Disabilities Administrator for the Department of Human Services. I'm going to talk tonight a little bit about mental health and the mental health mission and vision and the goals and objectives, as well as our accomplishments. The Delaware County Department of Human Services Mental Health Services Office is to assure the provision of a comprehensive array of quality mental health services and supports to eligible adults and children that will assist participants in maximizing autonomy, independence, and determination. We do this by collaborating with as many adults, families, systems, and providers as possible to identify individuals who are in need of mental health services. We strive to educate all of our stakeholders in our system and our system partners regarding the need for and the delivery of culturally competent, trauma-informed, evidence-based services. So I'm going to talk a little bit about our accomplishments for this year. The Mental Health Program Office has really invested a lot of time and energy into training some of our staff. We have invested in mental health first aid training for both adults and for children. We have obtained the funds and the ability to train some of our staff as trainers. We also have trained some of our staff and some of the staff in some of our provider agencies in the Transition to Independence program, which is a program that supports individuals who are in that 18 to 26 age group that are moving on and need an additional kind of support in that time frame. We have been fortunate enough to have 2 members of our team be put onto the Mental Health Planning Council, which is a really good opportunity for our office to be connected to the state in order to influence some of the decisions and the direction that mental health services are going. We have developed an accelerated course for CIT training for first responders, and that was facilitated in September of '24. Plus, we have offered our 40-hour CIT training for Delco offices, that was facilitated in May. We have had staff that have successfully completed the Criminal Justice Advisory Board CJAB conference at the Penn Stater. That is, as Sandy was saying, it's very important that we are collaborating with other departments and other agencies within the organizations, within the county. We've worked very hard this year to develop our relationship with the criminal justice partners, so having our staff attend that conference was a benefit to us and to them. And we also participated in the Judicial Summit for Behavioral Health. During Mental Health Awareness Month, which was in May, we had a variety of different opportunities for people to learn about mental health, learn about the importance of mental health supports and services. And we had quite a few different opportunities within the community at local YMCAs and other areas. We continued and completed our assessment of our crisis services, and we are now looking at the crisis continuum as we released an RFP for our crisis continuum, and we are working through those decisions related to that RFP. We're looking to develop the services that can address some of the gaps in the community related to crisis services. We worked with the Court and Community Connections Administrator and the District Attorney on moving forward with the Healthy Kids and Healthy Schools Initiative. We increased our blended case management providers to 5 providers. This is a really important service within the community. This is an entry point for people so that they can have a case manager that can assist them to connect to services. And for some people, this is a really critical step, as either they are discharged from inpatient or they are new to the system. It's very important that they're able to access case management right now, and I'm very happy to say that in this county, we do not have a wait list for blended case management, which is a real accomplishment for us in this community. We coordinated 9 monthly Zoom agenda development meetings, as well as 9 Delco community support with the community support program. We also trained 135 individuals, which involved the county staff of the Human Services Department, providers and partners, and trauma-informed care during this year. We have put a lot of energy and effort into ensuring that the services in the county are trauma-informed, and we do have trained facilitators, and all of our staff, when they come in, do receive that initial Trauma 101 training. We have our certified peer support team has initiated and has worked on many different support programs on a monthly basis. They'll bring in different types of training, such things like yoga or other kinds of supports into those meetings. Let's see. We also successfully were able to transfer 16 individuals from our LTSR that did close, unfortunately. But we were able to find opportunities for all of those individuals to live safely and productively. We had our first community residential graduation, which was an opportunity to really celebrate people as they moved from one level care to the next. And we are working with our community, as I said, around crisis services within the county, which we know is a high need here. So our initiatives and goals for the coming year are to continue to provide trauma training to our employees and to the county and any provider that requests it. To strengthen partnerships with the remaining residential treatment, the local inpatient and partial hospitalization programs regarding warm handoffs. This year, we were able to develop a warm handoff for CPS that is working with MVP and coordinates with the CRS warm handoff. So in many cases, we're able to provide individuals in emergency rooms or in other settings that have both training for the CRS and the CPS, which is beneficial since we know that many people have both of those needs. We have also formalized goals for our Early Childhood Mental Health Advisory Board. We have updated our training for emergency behavioral health volunteers and members. We will develop at least one walk-in crisis unit based on the SAMHSA toolkit. That is the RFP that I mentioned. We are hoping to successfully site and open a new long-term structured residence. That RFP is actually out now for that program. We'll finalize successful transition of our Marion Trace Community Residential Rehab Program. That program, we were able to support the provider to move the individuals to a new apartment complex. The complex that they were living in, the individuals living there not only had to share an apartment, but they had to share a bedroom. We're very happy to have been able to support them in acquiring a apartment complex where people they may have to share an apartment, but they do have their own bedroom, which is very important for people. And we'll be continuing our mental health first aid. We're hoping to be able to get trainers within each school district within the county so that those skills and abilities can be trained to any new staff. We are developing a veterans crisis response team. This is something that we are very connected with the VA and with our other court partners around making sure that we can provide support for veterans that are in crisis. The way that this works is that the crisis response team for veterans are police officers or first responders who themselves are veterans, so they can better support individuals that may be in crisis. So it's just another type of a peer support, another type of CIT. We are also exploring the opportunity of opening a transitional housing for women in Delco. Currently, we have transitional housing for men and not for women. Staff will continue to work on the Commonwealth's Mental Health Planning Council and advisory boards. We'll continue our CTI training to train as many police and first responders in the county as possible. And we'll hopefully be opening that long-term structured residence before the end of the year. With that, I will hand it over to Gianna.
Good evening, I'm Gianna Martin, Chief Financial Officer for the Department of Human Services. For fiscal year 2025-2026, we are projected to receive $50,033,065. We are projecting to spend that approximately 77% on mental health services, 17% on intellectual and developmental disabilities, 3% on drug and alcohol, 2% on homeless assistance, and 1% on human services developmental funds, noting that those funds, because of the block grant development, we are able to move that funding around as necessary should needs arise other places. And with that, I will turn it over to Chief Sandy Garrison.
All right. Thank you again for coming to our hearing. I want to acknowledge we have our County Executive Director here, Barbara O'Malley. We have several staff from Human Services. We have people from the Mental Health and Intellectual Disabilities Advisory Board, so thank you, everybody, for your attendance tonight. Again, this is our commitment. It's the same as our mission statement. We are committed to providing the services to our residents that they need and making sure those services are provided in an inclusive and equitable manner that's holistic, trauma-informed, and culturally competent approach to the services. I know those of you who have been at this meeting before know I see this every year. I love this hearing because we get to sit there and go through everything we've done, and I think when you're in it, when you're doing the work on a day-to-day basis, when you're dealing with everything that is potentially going wrong, as we all do in our offices at times, it's nice to sit back and reflect and say, wow, we really did do a lot over the year. It might not always seem like it, but when we go back and reflect on everything that's done, we've really accomplished a lot. And no, we could not have accomplished that without the support of the county, county council, our executive director, the administrators you heard from, but most importantly, the staff that do the work on a day-to-day basis, the caseworkers that are going out in the field, that are working with the individuals directly, that are connecting them to the services that they need, that are dealing and working with people as they enter the system when they're in crisis and not really sure how to even access services. It's those of you who have dealt with the human services system. It's a complex system. It's sometimes very overwhelming. I think even for myself as working in it, sometimes it's very overwhelming and complex. So the caseworkers are the individuals that are guiding our residents through those services every day. So to those that are listening, that work for human services or that work for the providers, thank you, thank you, thank you. We couldn't have done all these great things without you. So with that, I will turn it over for questions or comments or thoughts from anybody. Well, thank you again, and look forward to seeing everybody next year.